Hello, guys. Welcome to a very interesting webinar, a comprehensive explanation of type 2 diabetes reversal program. So, how we can reverse type 2 diabetes naturally without any medication. So, today we're going to understand first the root causes of such a modern epidemic. We are seeing it as an epidemic. Just in the span of last one generation, it has increased to almost fourfold globally. So, today, such an important topic. We're going to discuss everything in detail. With me, I have my colleagues, Mr. Kaushatai. He will be talking about the mental health and type 2 diabetes. Then I have with my another colleague, Dr. Namrata. She'll talk about hypertension, how to reverse hypertension naturally. So this is very interesting webinar. I think you should get hooked to this and be with us for at least 1 hour. And in this 30 minutes, I'll be talking about type 2 insights on type 2 diabetes. Dr. Namrata will talk about hypertension for 15 minutes, and Mr. Kaushatai will talk about mental health and the connection of diabetes and metabolic issues. So let's begin now. To start with, let's first understand what is type 2 diabetes. So type 2 diabetes is a metabolic condition. Type 2 diabetes is a metabolic disorder characterized by high blood glucose. So if you want to understand the root cause of type 2 diabetes, just simple one thing. I think that will make us really understand what is the basics, why we actually develop type 2 diabetes, why we develop these metabolic issues. It is simple. Two things you have to remember. One is high carbs. When you're eating food, too much of carbs in the food, causing high insulin in the body. High carbs and high insulin. So that means that whenever eating carbs, insulin is getting released. So the problem, the basic root problem is too much of carbs and too much of insulin. So now the solution is simple, isn't it? If you understand the root cause, that there's too much of carbohydrates in our food, and there's because of too much of ingestion of carbohydrates, there is a triggering to the pancreas, and the pancreas triggers and they release insulin. Why? Because insulin plays a very important role. It shifts the glucose from the blood into the tissues, into the cells. Simple. That's its work. But too much of that is needed whenever there's too much of blood sugars is found in the blood. So whenever there's too much of carbs we are finding, too much of sugar we are finding in the blood, you will see too much of insulin getting released. Understand? So there is a direct proportional between the amount of carbs you ingest and amount of insulin the pancreas is releasing, right? And that's what is happening in type 2 diabetes. The pancreas got exhausted. They're not dead. Pancreatic cells are not dead. What doctors think, they're dead. In type 1 diabetes, we understand. It happens. So next slide, if you see that, next slide. How type 2 diabetes became a global epidemic. So how it has become a global epidemic, we need to understand just in a single generation, the number of people worldwide suffering with diabetes has actually quadrupled, isn't it? That means a rare disease, which was very rare in 1970s and 80s, a very rare disease, has become the epidemic of 21st century. So this is an alarming situation for type 2 diabetes, isn't it? So the dramatic coincides. What it rise is directly shifts in the dietary. So why it happened? Why we are seeing too much of cases around the world? Because of two reasons. One is the dietary recommendations of 1977 by the American Diabetic Association. That's one of the reasons why we are seeing global rise in diabetes after 1980s, after their dietary guidelines. And then second is because of the food production practices. What is happening? Because of GMO food. Because what happened? The structure of the food is being altered. We thinking we are actually advancing by genetic engineering and all that. But actually, especially in food industry, we have actually destroyed the protein and the starch of the food. And because of that, when we're eating this new food, the genetically modified food, what is happening? It is converting into sugar very quickly. So there are two major reasons, remember that. One is a wrong dietary recommendation, thanks to American Diabetic Association of 1977. The second is the production, that is the food production practices, is one of the reasons why we are seeing a global epidemic, global rise of type 2 diabetes in a span of just hardly 1 or 2 generations, right? So this is what it talks about. Now, in 1980, what happened? What was the dietary guidelines? We need to understand that the dietary guideline, what they gave in 1980 by American Diabetic Association was they were pushing for high carbs. They said you can have more of carbs. So that means they said it was before, it was like people were having less of carbs. Before 1977, people were having good quality of fats before. But what happened in 1977, 1980 guidelines? They have pushed carbs, and they said, and what they did, the pyramid, the base of the pyramid, if you see the food pyramid, the base of the pyramid, what they said, you can have a lot of breads, pastas, and potatoes. This is what they said, which is not a good guidelines. But on the basis of that, what happened? The whole industry shifted. Whole industry, the caterers, the food industry, they shifted the whole focus from healthy fats to breads, pastas, and potatoes. That's why you see chips, and you see so much of abundance of chips in every takeaways. Thanks to American Diabetic Association. That's the guidelines we all followed, and today, unfortunately, we are the grip of the epidemic of type 2 diabetes. The other thing what they did is they have put a low-fat mandate. Everywhere you're seeing low-fat milk, low-fat consumption. So what they did, they have reduced the fat consumption, which was very good those days, and they reduced approximately from 40% of the calories down to just 30% of the calories. So they reduced the good quality of fats as per the recommendation, and they added a lot of carbs in the recommendation. When this recommendation people started following, industry started following, we started seeing rise in fatty livers, rise in non-alcoholic fatty livers. Why fatty liver? People saying that fatty liver. Before 1977-88, fatty livers were people only having alcohol. Now, because too much of carbs is simple. It's just too much of carbs, and two reasons. One is the wrong production, and the other is the wrong dietary guidelines. That's we have to remember why we are seeing this grip. The second is what happened after the 1980 dietary guidelines. Suddenly there was a immediate obesity response was there. So globally, people started following this diet, and a lot of food outlets started offering these kind of food to the people in the communities. What happened? There's an unprecedented climb of the cases of type 2 diabetes globally, and issues of metabolic issues. So people started developing metabolic issues. People started developing hypertension. People started developing a lot of lipids, right? And women started seeing PCOS. So this is all thanks to that American Diabetic Association and the genetically modified organism food, which was which we have seen in our times in 1980s and 90s. If you see people who are from 90s, 80s, and 90s, they have seen the invention of hybrid seeds and hybrid seeds. So these hybrid seeds, what are the hybrid seeds? What they did, they did great job. Scientists did great job at one side by taking care of the production and all that. From before, for example, in 1 acre of the land, there was 1 ton of wheat used to be yield. Now, after the GMO food, what happened? They were yielding nearly almost 10 times more. We got a lot of production. Food become abundance. But what happened? The quality of food has decreased. And because of that, we are seeing the global rise of diabetes. If you take the next slide, next slide. So you see the number of figures there from 108 million to 422 million just in a span of 1 decade. Okay, so this is unstoppable trajectory. If you see this one, the concerning fact is that it seems to be there's no end to this. There is no end to this. We are seeing it rise every year. We are seeing it increasing in numbers, increasing. So now by 2045, they're projecting. Next slide. By 2045, they're projecting. And they're predicting that it will cross at least 700 million people will be suffering with type 2 diabetes across the globe. So this is what the prediction is. And that is very alarming. And this burden of diabetes extends beyond individual health, to be very frank. It is affecting economics, productivity, healthcare system, and there's become a huge load on burden on the healthcare system. Just this one. And today, We have lost NHS, unfortunately, in US. Why? Because too much of burden of the ultimate bill of medications. Too much. Because for this disease, all you require is to just change your lifestyle, change your metabolic, change your lifestyle, change your habit. That's all you need to do. I will see that how easy it is to reverse type 2 diabetes. It is really one of the easiest things to do that. All you need to do is just give them a proper information to the people who are coming to the clinics, proper information to people who are actually taking these treatments for the doctors. So what happened? That this disease doesn't discriminate. It's this disease, if you see, it doesn't discriminate any kind of geographics. It doesn't discriminate, a developing nation or developed nations. So it is equally affecting all the nations, and it is a global problem, right? So if you see the other slides, so what about the 20? What happened is after this, and recently, in 2016, people like us, we started questioning them, dietary guidelines. A lot of doctors around the world started asking these questions. What happened in dietary guidelines? Why this wrong dietary guidelines is being given? So what happened? In 2016, they took a U-turn. What they did? They removed the fat restrictions were removed. Before, fat were restricted were there. Now they removed the restrictions on the total dietary fat. And what happened? And healthy fats were recognized. Before, they said, next slide, please. If you see that slide, if you see healthy fats were recognized. Before, they said egg, the yolk of the egg is a villain. They said it's a villain. They said avocado is a villain. They said nuts and olive oil. They said they're all villain. But now, after 2016 dietary guidelines, they've reversed this whole thing. And they say you can have this thing and given this a green signal to these kind of foods. Before, they've said, good food. These are good food, like avocado, nuts, and olive. And they blame it. They made the villains in 1970s. They said they are the villains. And we stop it. And ghee, they said ghee, which is clarified butter. They said it's villain. No, it's not at all. You're going to see that. We're getting amazing results with this thing. But they have changed it. But at 2016, they changed it, So now what is the traditional treatment approaches? We all know that somebody has type 1 diabetes. We understand it is insulin dependent. So we need to give insulin. Definitely. No doubt about that. And it is autoimmune disorder. And it is an autoimmune disorder. So what it means, autoimmune disorder means your own cells are attacking your own cells. The cells are attacking, the immune cells are attacking your own cells in the organs. Like, for example, autoimmune disease, how it starts? It all starts from the gut. What happens? When when we're eating this food, our body is taking this as a foreign object, and what is happening is creating antibodies against that. Then these antigen antibodies complexes, they are creating inflammation. They're creating leaky guts. When they pass through the leaky gut and goes and sit in the joints, you'll get arthritis. Go in the thyroid, you get Hashimoto-thyroiditis, right? And what happens? Go and sit on the pancreas and attack pancreatic cells. You get type 1 diabetes. And type 1 diabetes is also reversible if we catch hold of that disease in the early phase of the attack. So even type 1 is reversible. So they don't have to lose any hope in any of the diseases. Okay. Now type 2 diabetes is because of what? It is because of metabolic issues. It is because of lifestyle disorder. But what is the current treatment approach? They are focusing on reducing the blood sugar. What is blood sugar? Blood sugar is nothing but is a symptom. Blood sugar is nothing but a symptom. But too much of focus has been given, too much attention has been given to blood sugar. So there are two things happening in the body when somebody is having diabetes. They're having two toxicities. One is insulin toxicity, the other is sugar toxicity, that is called glucotoxicity. So if you see the type, what is the symptoms? If you see symptoms of type 2 diabetes, simple. Too much of pain is there, feeling thirsty most of the times, right? Then feeling very tired, lack of energy, losing weight, right? Then you have this itching around your regions, your genital areas, and eating more than usual, and feeling too much of eating, too much of peeing, right? These are all the symptoms of type 2 diabetes. Okay. So, and you see a lot of things will happen when you get developed diabetes. Like, you don't heal properly, the cuts and wounds, you don't heal properly, and you develop even as Alzheimer's now. They have said that you develop Alzheimer's, dementia symptoms, and symptoms of dementia, and then you have the blurred vision at the same time, right? So this is what you're going to develop when you develop type 2 diabetes. So So key to reversing type 2 diabetes. The next slide. The key to reversing type 2 diabetes is to managing, not to manage the symptoms, but to focus on the root cause. How are we going to focus on the root cause? First we need to understand what is the root cause. The root cause is what? That is insulin resistance, isn't it? So you take the next slide, please. Insulin resistance. So insulin resistance is the root cause of type 2 diabetes. How we develop insulin resistance? How we develop insulin resistance is because of too much of insulin getting released. Because every time eating carbs, body is, to compensate that, body is releasing insulin. So too much of insulin, what is happening? So this is the problem you're seeing that here. If you see that, what is the main problem here? It is the insulin resistance you develop. Why? How you develop the insulin resistance? That is the insulin receptors, which are there on every muscle and every tissue is being affected. So that's the key pathway. It is affected. The second thing is reduce glucose uptake. When these receptors are affected, the glucose is not getting ingested properly. So the reduced glucose uptake is there. That means the skeletal muscles are not getting glucose, and there's a problem with the metabolism of the glucose, metabolism of the insulin. So what is happening because of this thing? Progressive beta cell dysfunction is happening. That is because of chronic overstimulation. Because insulin has been, pancreas is releasing insulin so much that because of too much of insulin getting released, too much of overstimulation of the pancreas got tired. They just got tired. They're not dead. They're just tired. Okay. So now what is that? Understanding the insulin resistance development, right? So what is happening? Insulin role in the body is simple. Number one, the next slide, please. The number one is insulin's role in the body. Insulin is a hormone released by the pancreas to regulate blood sugar levels. That's number one. Second is chronic overstimulation. Chronic overstimulation with constant release due to frequent eating and overconsumption. You get releasing too much of overstimulation is happening. Of what? Of insulin. So we are releasing too much of insulin. Third is linked to obesity and metabolic syndrome. The third one is what is happening because understanding the connection in insulin resistance, obesity, and a development of metabolic syndrome. What is metabolic syndrome? Metabolic syndrome is a cluster of various diseases. When somebody gets diabetes, they just don't get diabetes per se alone. They will get associated diseases like cholesterol also. They will get cholesterol also, or they get hypertension also. With Dr. Namrata, we're going to talk about hypertension now in a bit. So people are developing not only one disease. They develop, it's a cluster of metabolic disease. So some people will develop either as standalone diabetes, some people will develop just hypertension, some cholesterol, some get in one or two together. So that's what we have to do. Basically, what is needed is people should be educated. People should know that this is part of a bigger picture. And that metabolic syndrome is because of too much of release of insulin. That's it. That what is happening in the body? Two toxicities happening. If you go to the next slide, if you see this next slide, so what is happening? The cluster of risk factors, you will see that. What is the risk factors? And whenever you have this, one of these, what is happening in metabolic syndrome? I'll tell you that. Right? What is happening? You develop hypertension, you develop obesity, you get high TG, high triglycerides, and low HDLs and insulin. Because of this, we are developing all these metabolic syndrome. These are part of metabolic syndrome. What is, again I repeat, type 1 diabetes, hypertension, lipids, right? Then you have PCOS, then high triglycerides and obesity. This is part of all metabolic syndrome. Why are we developing them? Because of insulin resistance. And what happens? Because of these diseases, this cluster of metabolic issues, a lot of risk factors can happen. It increases risk factors of modern metabolic diseases, like for example heart attacks can come, right? Because why? Because you're having this one or two part of the metabolic syndrome, and this is all because of one issue only, that is metabolic syndrome. And if you focus, what is happening at our platforms, people are coming for type 2 diabetes reversal program, right? And what happens at the same time, if the blood pressure, if linked to metabolic syndrome, that also blood pressure is also going off. The blood pressure coming off, the cholesterols are coming off. So this is what we are doing here. Hi, Manruchi, you're there. Thank you for joining us for the show. Thank you for coming us. Yeah, you have any questions? We'll give you the time at the end. We can have some discussion on the questions and answers at the same time. So what is happening is, it is not coming per se alone. It is always comes with either diabetes. Even diabetes will always come with cholesterol or hypertension, right? Or other metabolic syndromes as well, like PCOS and all that. So this is never gonna come alone. It always comes together, and because the reason for that is because it is not a disease as such alone. Type 2 diabetes is not a disease, it is a symptom. It is a symptom of a metabolic syndrome. High blood pressure is a symptom of a metabolic syndrome, right? High cholesterol is a symptom of a metabolic syndrome. So people have to understand this. If you understand the root cause, the simple root cause is simple. What is root cause? Too much of carbs, too much of insulin getting released. If we understand this phenomena, we can easily reverse this condition. We easily reverse. The main problem is too much of insulin getting released, and because of that, pancreas got tired. वो बोले कि थक गए हैं, अभी हम थक गए हैं, अभी हम कुछ इंसुलिन पैदा नहीं कर सकते. That's what we are doing is we regenerating that on our platform. How we are doing that? By our food, by intermittent fasting. I'm going to show you how we're going to do that now. So now if you see that, what is the main two things happening in the body? People are suffering a metabolic issue, glucotoxicity and insulin toxicity. Two things. What is insulin toxicity? Because we're eating too much of carbs. Because of that, insulin is getting released. And this insulin toxicity happened for 10 years. Then after that, you see glucose coming out in the body. That's again a symptom, isn't it? So for 10 years, your insulin was releasing, like, compensating release. Too much of overstimulation was there because every time eating carb, insulin was released. And because of insulin, so much things happen in your body. What happened? It promotes inflammation. When it promotes inflammation, what it does, inflammation, it creates cellular dysfunction. And what happens to that? People develop weight gain. Too much of insulin, what happens? People develop weight gain, and problem of heart, cardiovascular disease, and other cancer risk also is part of this. Even risk of cancer is part of that. Okay, of what? Of insulin toxicity. Nobody talks about that. Nobody talks. You go to the doctor, they never talk about what happened 10 years before your diabetes, you're developing diabetes. They never talk. They don't discuss at all. They say, oh, sugar is high. They just focus on sugar. Sugar, that is a symptom. If you are having fever and you go to a doctor, what you're supposed to get from the doctor? Two things. One is the antibiotic. One is antipyretics. That is high fever. For high fever, they should give, and they should give for infection. What is the root cause? Also, they should give. If they're just giving you for just paracetamol, if they're just focusing on a symptom, that is the fever, what happens? You keep on going to the doctor. This is what's happening. This high blood sugar is a symptom. Root problem is insulin resistance. Too much of insulin got released. Overstimulation of pancreas happened, and because of that, pancreas are tired. They're not dead, unlike type 1 diabetes. Okay, so the reversal paradigm shift. So what we are doing here is, what is traditional approach? Doctors, what they do? They focus on the symptoms. They just focus on the symptom. You got diabetes, okay, take this metformin. You got hypertension, okay, take this one, hypertension tablet. You got lipids, take this for atorvastatin tablet for that. PCOS, okay, take this hormonal tablets. Obesity, now they got injection Monjoros and all that. Nobody's talking about the root cause. Nobody's talking about the what is the main problem? That is hyperinsulinemia. So at our place, what we are doing is we're trying to change the shift from people management of the disease to the cure and to the healing. Enough of management, enough of becoming the agents of the pharmaceutical company, big pharma. We had simply become the agents of big pharma. The other day I was talking to a doctor. I met one of the doctors just 2 days back, and the doctor was telling what to do. I said, why are you killing patients, man, by giving these medications? They're type 2 diabetes. Enough. Big pharma has got what they got. Enough now. Come on, stop killing patients. He said, no, what to do? Patients don't change their habits. But have you told the patient that this possibility is there? They have taken an informed decision that that's not happening. That's not happening. When you go to a doctor is not telling you, but he's presuming it, that he will not change the lifestyle. Come on. But this is not the way to do that, isn't it? They should tell you the information, give the correct information, tell you that, see, lifestyle and habits can change, can reverse this condition, right? And other thing is, this medication which I'm giving, this is all symptomatic. They should say this thing, and this is not happening. So that's what we are trying to do now. This is what we are trying to promote through our platform, that you have to start practicing. Doctors who are watching this, we have to tell them, you have to give them the complete information so that they take informed decisions. And what at our platform we're seeing amazing results. Day in, day out, we have amazing results coming in. Like, we have people who have been hooked to medication for nearly 25, 30 years. They started with one medication, 2, 3. If this is working, why they're adding medications? Tell me that. If this philosophy of managing the symptom is working, why they're adding the medications every now and then? Metformin, glycoside, and keep on adding that. Then at the end they put insulin. The problem is actually too much of insulin got released, and at the end they're putting insulin on you. Such a horrible thing to do. Such a worst thing to do to a person. Somebody is having the type 2 diabetes. Type 1, I understand. Insulin is needed, not for type 2. Okay, that's what. So reversal paradigm takes a fundamentally different approach. What we do, reversal paradigm, we reduce the dietary stimulus that drives high insulin and blood sugar in the first place. So I'm going to take you to quickly what are the things what we offer from our platform. People who are suffering with diabetes. We offer intermittent fasting. That's one of the good things to do. Why? It involves cycling between the periods of eating and voluntary fasting. What is happening with this thing? What is happening with fasting? You are keeping the insulin at the minimalist level with fasting, right? And when you're fasting, your fat, which is there, which has already been stored, is utilized and converted into glucose. So you're not getting this from the diet, but directly which is stores, which is glycogen, which is stored, which is storage of glucose in a liver called glycogen, right? That is getting utilized, right? Then the fat which is there when you do repeated fasting, the fat which is there, that is converted into glucose, right? And that's what it is utilizing. So there's too much of storage there, plenty of storage is there. We have to utilize the storage. When you utilize the storage, insulin sensitivity will improve. When you reduce the fat, when you reduce the weight, the sensitivity of insulin improves, and you reduce the symptoms of metabolic syndrome. That's simple. So intermittent fasting is the best thing to happen to the mankind. And we have been doing this fasting, all religious people. We have been fasting since like thousands of years. We have been fasting, right? Why? Because it's good for our health. It's good for us. It's good for our body. It promotes weight loss and fat burning, reduces inflammation. It reduces. Fasting is not supposed to say it is one of the miracles of God if you're doing that on a regular basis. People should get hooked to that fasting. So when somebody coming to a platform, we put them on fasting. We put them on Mondays and Thursday fast. We give them on fasting. We put them on intermittent fasting. We give basically daily fasting. We usually put, depending on patient to patient, we alter that fasting protocols. That's when we do that. Second thing, what we are focusing on is low carb and good quality of fat. If you see a lot of people, I've seen a lot of dietitians coming to my platform also. They just used to writing low fat milk, low fat dairy. But that's not the thing. Low fat dairy. Why it requires good fat? Good fat. When you eat good fat, what happens? Your good fat will go and create a satiety. It gives the feeling of fullness. If fat is less, what happened in 1970-80 guidelines, which I told you, which American Diabetic Association has given the guidelines? What happened that time? What happened? They reduced the quality of fat from 40% to 30%. Natural fat. What happened? When carbs reduce in our diet, when fat reduce, good quality fat is reduced in the diet, you eat too much of carbs as a compensation, because we need to feel full, isn't it? So what is happening? What we do, we reverse that. We reduce the carb, because carbs is triggering insulin. We don't want insulin to be triggered in your body, because we want to reverse your metabolic syndrome, isn't it? So we don't want insulin to get triggered. So we give very low carbs and very good quality of fat, like avocado. So there's a feast on our platform. People who come on our platform, they think, people who come to our platform, they like our food and they want our food. Why? Because we have not deprived them of anything. We include them with a lot of different kind of food, like different colors, like vegetables, good quality food, that they're going to get empowered at our platform. When somebody coming to our platform, it's just not like that. You get empowered at our platform. Okay. So I think I'll just take another 2-3 minutes, then I can hand over to Dr. Namrata. So we have the ketogenic diet is there, fasting mimicking diets are there. We have beautiful diets. All these diets, what we are offering from our platform is evidence-based diets. The clinical trials have been done on them, and we're closely following universities like Harvard University, and we have different departments and they're running this gastric projects now microbiome projects on the gut and all that. So we're closely following all these big universities around the world. So we are offering the platform, the evidence-based food to you people, and at the same time we clubbed a bit of Ayurveda, a bit of prophetic medicine, and that's what we are offering from us, and we're getting wonderful results at our platform. So anybody who's looking to reverse type 2 diabetes, the medication is not the answer. That's what I'm to say. Medication is not the answer. The answer lies in your diet? The answer lies in your kitchen. Answer lies in your table, what you're eating, right? So this is what, if you have any questions, we'll at the end of this session, we'll take the question and answers also from you, and Dr. Namrata will take care of it now. Dr. Namrata, please go ahead, please.
Hello.
Yep.
Yeah.
So Dr. Namrata will talk about hypertension, okay? How to reverse hypertension naturally, what kind of foods we can eat. See, hypertension comes because of many reasons, but majorly 80% of the hypertension in today's world is just because of metabolic syndrome, which I just said is part of this metabolic syndrome only. So that's, and we just say essential hypertension. So she's going to talk about this hypertension, not any other hypertension, okay? So please go ahead, Dr. Namrata. Oh, missed her. To Kaushal, I think we missed her. So let's wait for a minute and two.
Yeah.
If,
Okay. No problems. I think she's
yeah,
trying to
she's
connect
back.
another device.
Yeah, she's back. There you go, Dr. Namrata. Oh, yes. So probably the problem, no internet problem, electricity problem. Not much problem in India these days. Electricity problem, isn't it, Kaushal? You're in India right now, currently. You're traveling to India.
I am in Indra. I am in India. I'm in Gujarat. It's a place called Valsad.
In
There's not much electricity problem
Valsad.
nowadays. Yeah.
Hello.
Yep. Dr. Namrata, are you comfortable?
Yes, sir. Yes, sir. Only thing is, I wanted to display my screen, my PDF after yours.
Yeah.
So I think
Yeah.
that is creating some glitch here. So I have sent you, sir. Is मतलब, आपके laptop से is it available on the screen?
I'm not sure. Let me
The
send me the slide. You send me the slide.
Yeah, I have sent it to you, so on WhatsApp. I
So,
think there is a glitch in switching the slide.
can I just say, Dr. Namrata, if you just press the plus button, you know that screen at the bottom, it says a plus button. Press that, and then you can upload your
Yes,
file.
yes, that only I am doing, but it is not working. The slide is not showing.
Okay.
Now
Just
you
put
go ahead.
the.
Let me just share. You send me that on the WhatsApp. You send me on WhatsApp, please.
Yes, I have sent it to you, sir.
No WhatsApp. Okay, one second. Let me just check if I can. Uh, 1 second. Let me just go here quickly. So you can start your diets. You know, if you want to talk about some diet, you can go ahead, Dr. Namrata.
Yes, sir. Okay, so I'll be sharing a bit about the hypertension, how hypertension has become a silent epidemic on this planet, and how we can manage and reverse hypertension naturally. Okay, so first we will understand what is hypertension. See, hypertension, when we say it is a rapid increase in blood pressure or high blood pressure, is termed as hypertension. Okay, so everyone has a certain level of blood pressure going on in their bodies, but when it reaches a certain high level, that is termed as high BP or hypertension. Okay, so what is the major cause of hypertension these days? You see, hypertension is termed as a silent epidemic these days. Why? Because it is so silent, it is such a silent inflammation that you will never know that will lead to a cardiac arrest. That is a major cause of death in this world, right? So you don't know this small thing which will lead to a stroke or a cardiac arrest or angina attack. You never know, right? So why we are having hypertension on a rise these days? The major causes are lifestyle. Hypertension is the number one lifestyle disorders which can be easily managed and reversed with natural alternatives, with natural therapies, with therapeutic diet plans, isn't it? So one of the major factors of hypertension being lifestyle. Second is stress, in and the improper circadian rhythm, improper sleep patterns which we are following these days, and improper diet, junk food. See, whichever thing is readily available is automatically ill treated, and it is we are eating junk foods in so much intensity that we have seen that dieting is means normal eating is termed as dieting these days, which is not the correct scenario. So lifestyle, sleep, diet, and smoking, these are all the factors contributing to hypertension. So when you will see that symptoms of hypertension, what the symptoms you can see: persistent headache, you can see dizziness or lightedness in the body. Sometimes you can see vision blurriness in the vision, chest pain, fatigue, and confusion, and sometimes even constipation. Even gut-related issues occurs when hypertension is for prolonged not taken care of. Okay, and so what are the major factors contributing? I have said processed food, lifestyle, stress, and sleep. Okay, and apart from this, what are the key factors that have been risking the hypertension surge these days are excessive sodium. One of the major causings being excessive sodium in processed foods and junk items and packaged foods. Rising obesity. Obesity is among the second most causes of hypertension. Obesity is the mother of all diseases, you know. And chronic stress and sedentary lifestyle, all the things contributing to hypertension. And how, and is it hypertension really reversible? Yes. When hypertension has arisen metabolically due to metabolic disorder, it can be reversed. But for means for organic causes, like if a patient is having chronic kidney diseases, for that reason, if hypertension has arisen, it will be very difficult to reverse. But for metabolic causes, if the hypertension has arisen due to metabolic condition, we can surely reverse it naturally. Okay, we don't require pills to maintain hypertension or to decrease hypertension. We just require natural therapies, natural alternatives to maintain hypertension and to reverse hypertension naturally. All you have to do is stick to your healthy lifestyle, stick to your therapeutic diet, and maintain a healthy lifestyle. Okay, so I'll be sharing few measures with you how you can reverse hypertension naturally. Okay. So first thing is diet. Very important. What our body is made up of what we eat. Okay. So whatever we'll put in inside our body, that only thing will cover. If we will put bad food, disease will occur. If we will put good food, health will occur. Okay, in our bodies. So for hypertension, what important is DASH diet and Mediterranean diet, which have been proven scientifically and medically proven to reduce hypertension is DASH diet. What is DASH diet? Dietary approach to stop hypertension. This is nothing but a simple diet plan emphasizing on fruits, vegetables, whole grains, lean proteins, whole fat dairy. Okay. Potassium rich. See what happens in hypertension, your sodium is on a higher level. So what you have to take is potassium rich foods. So when you take potassium, sodium is automatically gets detoxified in your body. So once your sodium levels are normal, automatically your BP is under normal, automatically your blood pressure is under control. Okay, next is magnesium. Magnesium is very important nutrient for arterial flexibility. Okay, blood vessel flexibility helps regulate calcium movement in channels. So when your potassium, magnesium, and calcium are under an optimum level, your arterial health, your blood circulation is automatically normal. Okay, and we also emphasize this fiber rich diet and low sodium diet very helpfully help reduce hypertension. Okay, and then potassium rich fruits, I just mentioned potassium rich foods has to be included, compulsorily to be included in hypertension to manage hypertension. Nutrient dense vegetables, lean proteins, and healthy nuts and seeds. See, everyone wants to have a tasty food and junk, but in reference to our health, these are not good. These are not at all good, and hypertension is the major cause of death. So try not to include all these things into your diet. Okay, now foods to avoid or limit, you have to take you don't have to take processed and packaged foods at all. These all contains very high amount of salt and snacks in it. Fried items you should not take, because all these fried items at the end they get stuck in our arteries, which in turn clogs the arteries, and which is very hard for our blood to, means the blood gets stopped there. That is the reason of heart attack, right? Then sugary drinks and alcohol, these are the things feeding our diseases, so we don't have to take these at all. Okay, now I'll be sharing very specific things for you to manage your hypertension and in turn reverse your hypertension. Next slide, please, sir. Bottle gourd juice, which is a medically and research driven juice one slide before that. Bottle gourd juice is very effective, very effective in treating and reversing hypertension. We have seen patients drastically reducing their hypertensive pills once they switch to bottle gourd fasting and Arjun Bhakti. Arjun Bhakti is nothing but a herbal supplement we give specifically to hypertensive patients because it contains cardioprotective properties, because it contains good amount of potassium. So two things I would really suggest hypertensive patients watching this is bottle gourd juice and Arjun Bhakti. But keeping in mind, you have to always monitor your blood sugar, blood pressure levels once you start this taking medicinal diet. And then beetroot juice. Nitric oxide is termed as a Teflon for the arteries. So once you take beetroot juice, it will surely help you manage your cardiac health. Okay, and raw garlic. Raw garlic is a boon for mankind. You should take daily one garlic, raw garlic powder. Okay, and these are some measures which will really help you manage your hypertension and reverse it naturally. But surely you have to do it under some expert guidance. Okay, and apart from this, these are the natural medicinal therapies I have, food medicinal supplements I have suggested you. Now I will tell you some naturopathy therapies to support your blood pressure and to reverse it naturally. Okay, so hydrotherapy, one of the ancient therapies we use for to manage all the diseases, whether it's acute or whether it's chronic. Okay, so hydrotherapy is very important, very beneficial for blood pressure as well. So one of the a few of the therapies I've mentioned here. First is hot foot bath. Okay, what you have to do is just immerse your both the legs in hot water, bearable temperature. Just soak your legs for 20 minutes, and you will see your blood pressure slide going down naturally. Okay, this is nothing but just science, just science. When you immerse yourself in hot water, vasodilation takes place, and the overburden from the heart goes down to your lower extremities. Okay, and arm and leg pack. So the ideology here behind hydrotherapy treatments is that to lower down the burden on the heart, arm and leg packs, you just wrap arm and legs with warm towel, soak in water, wrap it along your arm and legs, and you will see blood directing towards arms and legs. So that will in turn lower down the pressure on the heart. Okay, and then nape on the ice on nape. Okay, so what you have to do here is just take a dollop of ice, just rub it on the nape of the neck. Okay, and that will stimulate your vagus nerve. Vagus nerve is the strongest nerve of the body, which will in turn turn your blood pressure levels. Okay, so all these things have to be done under expert guidance, or you can take our professional guidance. And then for some emergencies, here we have some few acupressure points to lower down your blood pressure. Okay, Li4, LV3, PC6. So we also give you expert guidance on acupressure, acupuncture, cupping, and many alternative therapies. Then of course, when stress is a major factor contributing for hypertension, few mind body practices should also be considered, like yoga, meditation, and deep breathing. Okay, and then lifestyle modification. Lifestyle modification, the cornerstone of reversing hypertension. See, when these are termed as lifestyle disorders, only thing that can reverse and manage these conditions is lifestyle. So when you treat your lifestyle, you treat the disease. So what you have to do is treating the lifestyle. Everything you do it from day to dawn, you have to just change it to natural living. Like you have to manage your sleep. You have to shift your circadian rhythm. Means circadian rhythm refers to when sun awakes, sunrise okay, you have to wake up, and when the sun sets you have to sleep. But in our busy lives this is not possible practically. So what you have to do is just shift your dietary patterns, just shift your sleeping schedule. Like in Ayurveda we say when the sun is on the peak, like in the from 12 p.m. to 2 p.m. you should eat your heaviest meal that time. Why? Because in Ayurveda text we have already mentioned this. So that is what we suggest at eMedicat platform. Like we like manage your whole lifestyle in such a way with the research driven protocols, right? We give you intermittent fasting, we give you sleep schedule, we give you we give you steps count, we manage your steps. So we don't do anything no rocket science is there, but we just alter your lifestyle, and that in turn helps you manage your disease. Okay, so this is what everything I have to tell you about hypertension. So at e-medicard we have helped n number of patients reversing their diabetes. Why reversing their diabetes? Because we give them direction, we give them lifestyle modifications, we give them medicinal diet, we give them naturopathy therapies. So if you have hypertension, if you are taking hypertensive pills today and you think you have to take this forever, for till your last breath, that is not the case. We are here to help you with all the best therapies we can. And all this I have to say, you can consult eMedicard anytime. And for the rest of the session, Mr. Kaushit, I will take over.
Yeah, okay, thank you. Sure, okay, shall I go ahead, Dr. Khan? Shall I go ahead? Okay, Dr. Amara, shall I go ahead now?
Yes, please.
Bismillahirrahmanirrahim. In the name of God, the most merciful, the most beneficent. Thank you, Dr. Saab, and thank you, Dr. Namrata. What you've just mentioned in terms of how to reverse your diabetes and hypertension is nothing new. A lot of people already know this. It's about how we think about this and what we can do. We are all responsible for ourselves, for our life, and our
Yes.
body and our mind. So I'll talk about how to manage your mind, how to manage your stress. Because if you're not able to manage your stress, continuously not managing your stress leads to depression. So you need to look at what are the causes of stress and the way to effectively manage. And what Dr. Namratas had mentioned in terms of food, sometimes people have food and they overeat because they consider it as comfort food, because they are stressed, because they have issues with mental health. And therefore, if you manage your stress, you'll be able to manage and control your diet as well and your food. And the food intake that we take, but particularly with comfort food, is always junk food. It's always cakes and biscuits and chocolates. We know this for a long time. So we should be all responsible for our own bodies and our mind. So in terms of mental health, there's a difference between mental health and mental illness. I'm going to focus on mental health because mental illness is something that you need to treat. It's a disease. You have to go to a psychiatrist, like schizophrenia, bipolar, depression, etc. But everybody can manage stress. Stress is inevitable. Everyone will go through stress. Is in our innate nature. Sometimes we get anxious because we got a job interview. That's normal. But when we are over anxious about of something that might happen, and it's in our thought, then that's this negative thinking. Then that can affect your stress levels as well. And if you're not able to manage that, then it can uh, increase the problems and increase your blood pressure. And now there's research that states and suggests that those people who have not able to manage their stress and have mental health problems, it can lead to diabetes as well. So there's a direct connection. So it comes back to our life choices and how we think about things. So lifestyle, what does that mean? It's about being healthy by being by doing exercise, by being active, by doing movement. But that's only 20%. 80% is your food, what you eat, what you consume. That is your choice because everything is out there, everything is available. You can go to a takeaway and get junk food quite easily. Dr. Saab mentioned chips, fried food, cakes and biscuits. It's easily available, but you need to resist this. There's a difference between food and product. A biscuit or a cake is a product. It's man-made. It's been made by industrial process and using so many seed oils, which is really bad for your gut, and also salt. You just mentioned, Dr. Namrata, about salt. There's huge amount of salt in takeaway food, and also a lot of sugar. So we need to avoid that. So the best way to manage your stress is to your own changing your own lifestyle. And the main factor in changing your lifestyle is movement and sleep and managing your stress. And these are the things that you need to do, because 80% is what you eat. And when we say that you are what you eat, that is so true. You are really what you eat. You become what you eat. And this is the reason why in many scriptures, pork is avoided. You have to avoid pork, avoid alcohol. In fact, in the UK and many Western countries, most of the liver diseases caused by overconsumption of alcohol. And now there's research that suggests that if you eat pork and pig content, then there's a huge problem in your gut as well. So there are certain things that are in our scriptures that we should be avoiding anyway. Dr. Sam, you mentioned about intermittent fasting. Dr. Mosley, professor who passed away not long ago, he recommended that people should be fasting twice a day, sorry, twice a week. And he was fasting himself. And he was fasting on Mondays and Thursdays. And the interviewer at the BBC asked him, "Why do you fast Mondays and Thursdays?" He said, "I heard that Prophet Muhammad, peace be upon him, also fasted on Mondays and Thursdays. So we should take this habit. It's not new in Islam only, but it's been happening till millennium. It's in the Hindu culture, it's in the Jewish culture, it's in many, many faiths as well. So if you're not spiritual, then at least you need to know that there are some benefits in fasting, intermittent fasting, because it helps your body to regenerate its cells, and any ailments that you have, it can repair this. Sometimes we eat food and we eat food on top of the food, and that's where the problem occurs. If you're eating breakfast and lunch and as well as a evening meal, and in between you have snacks, then you're not giving your body a rest. You're not giving your stomach a rest. And this is the reason why when you fast, your molecules are re-energized, and it helps your whole body system, but also your mind as well. So intermittent fasting is something that is very much recommended. Um, and also GM food. Now we know that there's so many foods that are genetically produced, and we need to avoid that. And this is the reason why sometimes Dr. Namrata said that it's better to get some guidance from people who are experts. What foods to avoid, what foods to eat, what is organic food, what is GM food, how you can grow your own food as well, and which places that you can buy food, and which ones are the best ones. So this is something that's very, very important. Coming back to stress now, um, there are 4 ways of managing your stress. 4 A's. One is to avoid. So avoid unhealthy food, avoid negative media, avoid bad news, for example. So avoidance is very important to manage your stress. All the things that affect you and triggers your stress, avoid them. And the two things I mentioned was avoid negative assumptions, but also negative news, but also negative food that has an impact on your body. So that's for the first A. The second A is accept. If anything that's happened to you in life, accept it, because that was inevitable. And if you're a believer, if you're a Muslim, then you believe in the Qadr. It happens with the will of Allah. And even if in many other scriptures as well, that is karma as well. Whatever's happened has happened. It's been destined for you. Accept it. That's the first part. 80% of managing your stress is accepting what's happened to you, because then you can move on. If you have a tire puncture on the motorway, you're traveling along, rather than dwelling why that puncture happened or blaming somebody that my son didn't check the tire, move on and do something about it. So the most important part in managing your stress is accepting that the puncture has happened. So acceptance is the second A. The third A is alter your thinking. Whenever something's happened to you, you alter your thinking, your mind, as to what needs to be done next. So alter your thinking. And the way to do that is always be a positive thinker, not a negative thinker. Though most people who are stressed are because they are negative thinker and they have negative assumptions of themselves, and also of other people. If somebody says something to you badly, you don't take it negatively. You just assume that they didn't mean to do that to you. They didn't mean to say that to you, or they made a mistake. Or if you wave at somebody and they don't wave you back, then you assume that they didn't see you. If you're in the car and you're waving at somebody, sometimes the screen of your your car screen has a reflection, they didn't see you. So have an assumption of a positive thing. That way, it will help you to manage your stress. So be a positive thinker in everything that you do. Be an optimist, not a pessimist. Don't consider half glass. The water is the water filled with the glass filled with water is only half full, but consider it as half full, not half empty. And this is the way of positive thinking. The third thing is so accept, adapt. Yeah, the last one is adapt, adapting to the situation. So if you have a puncture, for example, adapt to the situation that you're in. You might not get to the airport, for example, or you might get to the airport if you change the tire. Adapt to thinking. And that way it'll help you to manage your stress. So positive thinking, not negative thinking, helps you to do that. And lastly, sleeping well. You will only sleep well if you don't overeat. Your last meal should be the earliest evening. Some say, I think Dr. Namrata, you mentioned 6 o'clock, isn't it? Your last food should be at 6 o'clock, 6 p.m. Is that right?
Yes.
So don't eat after that, because otherwise you're not able to go to sleep. And the quality of sleep determines at what time you sleep, but also how deep you sleep. Sometimes if you overeat and if you've drunk before you sleeping as well, you're going to get up early in the morning or in the middle of the night to go to the toilet to wee. So therefore, avoiding food and drink before you sleep is much better. But also, if you have actually managed to be able to uh, think positively, you'll be able to sleep better. And lastly, forgive people. If somebody has wronged you, just say to yourself, they made a mistake, but I forgive them. And if you're a believer, you can say, oh, I forgive them for the sake of God. In Islam, the first beneficiary of the one who forgive others are themselves, not only psychologically, but also spiritually as well. So forgive people who have wronged you. Maybe they might not have meant to be wronging you anyway in the first place. So don't keep a grudge against somebody. Otherwise, that's going to stress you out a lot. I know that my time is up. The stress management is a 2-day workshop, and I dwell on it much further. How to manage conflict? What are the 4 A's? How can we go deeply? How can you manage your food appropriately and effectively? But in a nutshell, I've just done a whistle top tour of stress management in 10 minutes. So if there's any
That's very
questions,
good.
please ask any questions you want for those who are listening.
I'm not sure if anybody has any questions. Please go ahead with us, please. We are there to take your questions. But it was great hearing you, Kaushal Bhai and Dr. Namrata. You also spoke very nice, and we could learn so many things, from each other. This is what the platform is all about: giving ethical and honest opinions from a platform, isn't it? And we want to promote this honesty even in terms of in overall all healthcare fraternity. This is what we are trying to encourage. Doctors also, people who are watching also, we should do ethical practice, isn't it? That's very important, and that will help the mankind and the community, because today, as you see, Kosharai, a lot of people are dying, unfortunately, in front of our eyes. You will see that as a doctor, and I know now it is all reversible. Everything is reversible. I have some friends who been unfortunately been had to undergo bypass at the same time because they were put on insulin and so much of medications they were on for almost 10, 10, 15, 20 years. So it's very sad to see this, though it's so easy to reverse, just all you have to do is change your lifestyle. And definitely, because we are here to help and guide. If you're on a medication, anybody's on the medication, they require a little more support and more guidance there. This is what we provide at our platform, a completely evidence-based guidance what we provide, and this is how we bring people to revert stage, to reversing them and bringing them back to their default state of their metabolic health. So thank you everyone for watching us, and keep following us so that we keep on coming up with such kind of more webinars in future. And please follow us and like and subscribe us, and at the same time, please share a word of hope to the people who actually suffering with diabetes and suffering with a lot of other metabolic issues. And they have lost hope. They have lost hope. So please kindly be positive, as Kaushal Bhai said, and be positive. Kaushal Bhai, I wanted to say some last word, please, from your side.
Okay, yeah. So thank you for those who have been listening. Just remember, you have the power to change your own lifestyle. You are responsible for your own body, and you owe it to yourself not only to for your body but for your own soul. So work hard on that, get some advice, or you already know, do a lot of research. Everything is available. Stop taking medication when you know that there are alternatives as well. Obviously, go and seek advice from the doctor, definitely, but at the same time, always seek for alternatives, because alternative method is out there and it's very easily available. Thank you.
Definitely. Definitely. Thank you. Dr. Namrata, would like to say anything at the end?
Yeah, yeah. Yeah, thank you everyone for watching us and giving your precious time to us and listening us. And I just want to end with this: like, health is health and disease. Both the things are our in our hands only. So we are the makers of our health, and we are the makers of our disease only. So kindly come to eMedicard for any expert guidance you need, and we are there to help you. Thank you. So that's all.
Thank you, everyone. Thank you for watching it. Thank you. Take care. Thank you so much. Take care. Bye bye.